Hi, I'm Dr. Julie. I'm the neurologist on call tonight. It's a pleasure to meet you. Okay. So, all right. Looks like all your labs are good. Okay, so I'm not too worried about that. Okay. Can you tell me a little bit about what brought you here tonight? Let me just get my gloves on real quick. Okay. All right. Okay. So, tell me more about the accident itself. Okay. Uh-huh. Has that ever happened in the past? Okay. When did that start? Do you take any medication for those? Okay. Had you stopped taking your medication recently, or has anything changed that might have brought on the seizure? Okay. Yeah. That's understandable. Okay. What time did this happen tonight? All right. Okay. Had you had anything to drink? Any drugs or other substances before this happened? Okay. No, that shouldn't affect anything. No. I don't think soft drinks are going to make that much of a difference. Okay. When this happened, did you black out or pass out at all, lose consciousness? Okay. And what happened when you woke back up? Okay. Any halos of light in your vision? It's kind of like sometimes you'll see rings of color or just certain colors. And sometimes it's just a brightness on either side of the vision or above or below. Have you ever had that happen before? Mm-hmm. Does that happen before things like this? Okay. Do you take anything for those? Did you have a headache tonight before this started? Okay. And when did that start? Okay. All right. Any ringing in your ears? No. Okay. What about now? Do you have a headache now? Okay. Is it worse than the one you had before the accident? Okay. Has the type of pain changed? Is it a throbbing pain, just kind of a dull ache? Okay. Okay. All right. And where exactly is the pain? Is it in the front of your head, on the sides, in the back lower part? Okay. Is that where you normally have the headaches at? No. Normally in the front? Yeah. Those tend to be sinus headaches. If it's right here in the front or between the eyes, even right here on the sides of the temple. Yeah. Okay. Any nausea? Feeling like you're going to throw up since this happened? Okay. Nope, that's a good thing. All right. Well, that's fantastic. If any of those things change and you do have any vision changes at all, whether that's just blurriness or if any colors change, or if you do see some halos of light, or if you start having ringing in either ear, or if you start to feel nauseous, like you're going to throw up, just press your light and let us know immediately, okay? That could signal more things going on than what we're expecting, okay? All right. So I just want to do a thorough neurological exam on you. It's more just making sure the cranial nerves are all good, no signs of bleeding in the brain or in the head anywhere, making sure your vision and your hearing are all still the way they should be. Okay, are you all right with that? Great. Okay, let's start with the easy stuff. Can you tell me your full name? Okay, and your date of birth? Do you know what year it is? Yep, that's right. Okay. Do you know where you're at? Okay. Which hospital exactly? Excellent. Okay. Let's go ahead and start with your eyes. So I'm just going to shine this little light here in your eyes. I don't want you to look into the light though. I want you to look up at the ceiling. Okay. I'm just going to check the response of your pupils to the light, okay? All right, so start with that one. And then this one. Okay. Right. Now I expect them to get smaller when I shine the light on them. That's the normal response. And yours got smaller, so we're good. Okay. All right. Now I just want you to follow this with just your eyes. Not your whole head, just your eyes, okay? Okay. All right. Okay. Excellent. I'm just looking to see if if either eye doesn't respond at the same time the other one does, or if they kind of stick in one spot and don't respond immediately to following this. No, everything looks good. Okay. All right, so I'm just gonna touch your face right here above your eyes, beside your nose, beside your mouth. I'm going to touch both sides of your face, and I want you to tell me if either side feels different. If one side feels different than the other, if it's more pressure, or if you don't feel it at all. Okay. All right. Both sides feel the same? Good. Okay, and your nose. All right, and okay. Both sides the same? All right. Great. Okay. Just going to touch your chin here. Can you open your mouth for me? Great. I'm going to put my hands on the side of your jaw. I'm just going to apply a little bit of pressure, and I want you to bite down when I do, okay? Right. So bite down for me. Good. Okay. Can you raise your eyebrows for me? Good. Can you give me a smile? Okay. And can you stick out your tongue? All right, can you move it to either side? Great. Yeah, I know it seems silly, but it's the way we test cranial nerve 12. Controls the mouth. So if when you stuck out your tongue it wasn't in the middle, then that could indicate a problem. Or if you were unable to smile for me or lift your eyebrows. Yeah, the same nerve controls the eyebrows and the mouth. Okay, so another silly thing, can you puff out your cheeks for me? Just puff them out. Great. That's cranial nerve number 7. Okay, everything's looking good so far. I just want to check your reflexes. So, doesn't hurt. Just gonna give you a little tap on the back of the arm. So let's start with this arm. Just relax your arms. All right. Good. And then this side. Right. Okay, so just scoot to the edge of the table here and just let your legs dangle. I'm just gonna tap the front of your knee here, okay? Right. And this side. Okay. Right, and then your feet. Everything looks good. Okay. Alright, so alright. Okay. Okay, so the last thing I want to check is your hearing. So I want you to close your eyes, and I'm just going to use my tuning fork. So go ahead and close your eyes for me, and then whichever side you hear it on, I want you to raise that hand for me, okay? All right, great. So go ahead and close your eyes. Okay. Good. Okay, great. Okay. What about now? Not hearing anything on either side? That's good. I didn't hit it that time. Okay, one more time. Okay. All right. Now everything looks good. I do want to follow up with some of the labs. Now, I don't want to send you home just yet. I'm going to recommend that we just keep you overnight for observation. Just to make sure nothing happens. You had a pretty severe concussion. So I just want to keep an eye on you and make sure everything still looks okay. All right? We are going to keep doing the neurological checks on you, just to make sure everything's staying the same. So I will be back in 4 hours to check on you again, okay? So try and get some rest until then.